everyone. This is Dr. Alex Eson. I'm a hematologist oncologist. The talk today is basically about a very simple question. Have you ever been told that your platelet count is low, and you're immediately wondered, does that mean I have cancer? I want to tell you about Lucy. She's 30 years old. She came in to see me for low platelets from her primary care doctor. She had noticed for, I guess, a few weeks that she was bruising a little bit more, and she also told me that her periods had doubled last month in comparison to what normally they're like. And understandably, she was very anxious, not having had a regular cycle. She also told me that she'd like to lose some weight, and uh, she was anxious. So what I wanted her to know was that low platelet count doesn't automatically mean something dangerous is happening. There are many causes of low platelets, and many of them are completely treatable. And I'm going to walk you through it like I did with Lucy. What are platelets? We got these tiny cells that are wonderful. They keep us from bleeding. When you cut yourself and I shave myself, normally we want our platelets to be between 150 to 450,000, but that's not always the case. If it is less than 150,000, automatically you're told that you have low platelet count, medically speaking, thrombocytopenia. With Lucy, I started with a history. We spoke. Uh, the thoughts that usually come to mind is nosebleed, bleeding gums that happen often, petechiae, blood or urine in the stool, the menstrual changes that she told me about, any new medicines, herbal, etc., antibiotics, over-the-counter stuff, and sometimes platelets are just low, and it's because they stick together. The computer doesn't pick them up, and it messes everything up. An infection, a viral infection, can cause that. Scary stuff like hepatitis, HIV, Epstein-Barr virus can do that. And generally speaking, if you don't know what it is, they call us idiots, and therefore that's what's called ITP, idiopathic thrombocytopenia, or autoimmune thrombocytopenia, meaning we are idiotically not knowing why your platelets are low. And sometimes the immune system feels like your platelets are foreign to you and your spleen chews them up. And so one of the tests I ended up ordering on Lucy was an ultrasound of the abdomen to look at her spleen. And I will be evaluating her for basically the splenomegaly to look into this further. At some point, we will check her for hepatitis. We will check her for things like lupus, scleroderma, or autoimmune disease. And the most important thing is, if she's not having much difficulty, do I really need to treat her? The question is, do I give her steroids? I don't think she's going to like that because she doesn't want to gain weight. Do I give her immunoglobulin? Do I give her medicines to stimulate her platelet production? Or in case of Lucy, could it be the alcohol that she drank when she was younger and it has caused her to have non-alcoholic and or alcoholic autoimmune disease of some sort? And that could be definitely figured out as we do the abdominal ultrasound. Her liver function is going to be rechecked again. She may have hormonal changes, thyroid changes. She may have developed fibroids in her uterus. And those are things that we'll be looking at. So the most important thing really at this point is going to be to make sure the iron level is good. She sees her primary care doctor. If she needs a pap smear, that gets done. And I'm going to repeat most of these blood tests. Look at the blood under a microscope. Definitely make sure the platelets are not clumped together because sometimes that happens as well and it frightens everybody and it's irrelevant to an actual disease. Her kidney function has been normal, liver function has been normal, basic iron and B12, all of that has been normal. So the question then becomes, is she going to need a bone marrow biopsy? Not immediately, and I told her that. The next question is, could I have something genetic? She doesn't have any relatives that have that. And the treatment really depends on the fact that if she needs to get some of these pills to motivate her body to make more platelets, or If it's alcohol or sugar or just poor diet, she's definitely going to make a difference. And that's going to be in her hands, and I know she's very motivated to do so, and she's going to lose the extra weight and hopefully do well. What I told her most importantly was that this is a very treatable condition. There's many reasons to be hopeful, and my goal in this video is to help you understand complicated medical conditions in a way that's quite clear, I think, by this point, and hopefully a little less frightening. Please check with your own doctor if you're not my patient. And if you're Lucy, I will be taking care of you hopefully in a few weeks. Best of luck, and we will get the workup done as soon as possible.